last year in Paris, COP21, we were one of 16 projects they selected, 16 solutions among 450 to showcase that there are solutions. I wanted to show you the film from UNFCCC from Paris last year.
Solvatten is a technology that uses sunlight, UV, to purify water.
It's a container, 10 liters container. You open it up to the sun and let the sun shine, and in a couple of hours you have a green happy face on the indicator, and then you know you have safe water and you have hot water.
Almost like 60% of people living in Kenya use biomass. In many cases, charcoal or firewood. And so usage of Solvatten reduces deforestation.
Before we started using the Solvatten, we used to buy charcoal like 200 shillings, but now the cost has gone down by 100. There's no cost for using the charcoal for boiling water again. I use it 4 times in a day. There's no more suffering from typhoid and the small stomach ailments like diarrhea. It has also gone down.
In Kibera, we have 2,590 families, but totally Solvatten is today serving 42,000 families in the world. We see hygiene, poverty and energy access as related, and then we can see the world and the environment and the climate on top of that. It's for us what we really can see as an impact of Solvatten.
Yes, and I want to explain a little bit more about what Solvatten is and what we are doing. But first of all, the huge problem, and it's a problem not just about unsafe water, it's also about hygiene, poverty, and energy, lack of energy, and poor sanitation. And this is a daily challenge for many people in the world living with unsafe water, where the piped water isn't safe, where the wells are contaminated. The struggle we heard earlier today about collecting fuel wood and to fire, to use the fuel wood to cook or to boil water. And the charcoal need of charcoal. And it's also, for us, we have seen the impact or the daily challenge when people do not have access to either hot or safe cold water. It's a distant dream for many people. And as with Janice, she lives in Bungoma, Western Province of Kenya. And they have some plans for development, and the development plan should reach out to those areas around 2030. But at that time, Janice will be about 52 years old. And if the plan is there, you don't know. And the use of Solvatten, when she uses Solvatten, it's about dignity. Everyone needs to be clean and healthy, and to use Solvatten is a tool for her and her family. But the background to see the huge amount of fuel wood needed when just 14% of sub-Saharan Africa has access to electricity or to energy. And then you use charcoal or fuel wood, and to produce a bucket or a kilo of charcoal, you need about 10 times the amount of wood. And in Haiti, we also talked about Haiti earlier today, and Haiti is just less than 2%. This was before Matthew came. less than 2% of the forest remains. And I was flowing over Haiti. We started the Solvatten project in Haiti after the earthquake. And we flew over and you could see the border from Dominican Republic, green, beautiful green, the water, the ocean is turquoise blue, and then you come over to Haiti and it's brown. It's, the forest is gone. The deforestation has also caused the soil erosion, and the water slipping down this ocean, you could see it was brown and all garbage out. It's really hard when you can see the whole effect of when you take away the forest. And with Solvatten, perhaps I just show you because it's here, I don't need pictures for it, but it's to fill dirty water into the black openings, and there is a small filter to reduce turbidity, and you fill it with 10 liters, it's about 2.6 or 7 gallons, I think. And when you have filled it with dirty water, you put it in a good angle to the sun. So if the sun was there, I pretend the sun is there, it helps to see the shadow underneath the ring. You know you have the 90 degrees angle. And to put it in the sun for a couple of hours, the indicator tells when the water is safe. It turns from a red unhappy face to a green happy face. So that's easy to use, and the water gets hot, about I think can reach up to 167 Fahrenheit. But what happened is we use the UVB and we use the heat together. It's a synergetic effect that the microorganisms, they get fragile from the hot water, but allows then UVB to destroy the DNA code, the bindings, so the microorganisms cannot reproduce. We treat water for virus, parasites, and bacteria, so very highly contaminated water. And instead of using Solvatten, it's used about 6,000 liters a year in Western Province, and used now, we have seen it in the field for 7 years. So, I mean, it's about 60,000 liters of safe and hot water. And to buy water, just drinking water from bottles, it's about more than a ton of plastic that you can avoid with Solvatten. It's also, we looked at how many trees can still be standing. It's about 5-6 mid-sized trees can still be standing. And use of hot water instead of boiling, it's easy then to preheat the water, to store it in a thermos, give your baby a bath, and to drink tea directly. That's some of the possibilities. It's also with malnourished children, to avoid that. There are a lot of soil-transmitted diseases. It's not always from drinking water, it's from the soil, and improved hygiene helps to prevent. And more than 2 billion people live with intestinal worms, mainly children, eating the food they should have. And to give nutrients to malnourished children, it's a powder, and without giving it hot water and safe water, it's not a help. But Solvatten can help out because the nutrient has to be about 55 degrees to dissolve. And we work with a lot of partners. We have good results from the fields. We have seen impact on skin diseases has gone down, diarrheal diseases, eye infections, and that we have with a lot of projects, the results from projects we are running with partners. But why is Solvatten good? Today we have 45,000 families using Solvatten, and we have seen the uptake. I think a solution isn't a solution before people really use it. So we have seen the uptake is very high, and probably it's economical for the families. You save a lot of money, and you save a lot of time and health. But time is, I think, a very important part of especially development for women around the world living in poverty. To lift yourself from the situation, you need time and you need a healthy family. And a lot of small business opportunity has occurred. As hairdressers in the slum in Uganda, they use Solvatten to reduce cost for electricity or gas. The small farmers milking the cow, you could wash the udder before milking, and the milk lasts longer. A lot of small business opportunities. And of course, we have had milestones during our journey. Started quite a long time ago. I had the idea, and I wanted to create a tool for women, especially. And now we have, I mean, you have to do a lot of, as you see on the, you have to do a lot of steps to come where we are today. But now with the goals we have, we want to reduce poverty, and we see we have already started the journey, but it's just a drop in the ocean today. And also to find a good partner who can help out to distribute Solvatten in a bigger scale. And to, yeah, also to reach more area. We're working in 20 countries today. And to see the business model, it's to really start with to lower the cost for production and to reach more people, you need to come down in price. It's cost about $90 to Solvatten today, but can we, with volumes, come down in price till about half? It would be much more easier to access the open market. And to pay in installments, that's what we do today. But we also work with governments, and here it's a climate fund. We're working with Zambia to do a bigger program. To start, you can have the climate fund as a catalytic help to reduce cost and to make then the payback with also reduction of carbon emission. We work with UN, we work with companies mainly in Sweden to reduce, it's also the gap that's reducing the cost for the people who are buying Solvatten. So you can buy it for a very low cost, and we have to cover it from other sources. It's complex, but it works, but it's also a lot of learning. And we are interested to look in micro health insurances to see, can Solvatten be kind of a fire alarm for health and to be added to a micro health insurance? That could be one way to go forward. It's also a way to look for outdoor living market, to see all the people going for safari, or that could also be a way to reduce the cost. But we haven't been focused to those who need it. We have been focused on those who need it the most vulnerable people. And I think that has also helped us with the insight how important it is to really serve a family with both safe and hot water. We are a small group of people working with Solvatten. Daily we are 5 people, but a lot of voluntary people around. It's my family, my 2 boys working with me. And I think it's the strength and the talent everyone has from different parts with knowledge coming into the company is so important. But we want to grow, we want to scale up. And I think this picture is telling, this is in northern Kenya, in Kakuma, to see the families, to be there, because we used to go to where the projects are. We used to be there to start up and to see her and to see her family, to have some hope. And I think solutions need to give hope, not to be focused just on the problem, look at the solution. And yes, and for me, I think it's so important to look for the impact today for our children in the future, our grandchildren. I have today 6 grandchildren, and I think to work today to see a bit beyond the horizon and not always think of return of investment in money, think of impact. Thank you.
That was great. So I have a question. So when you open it up and put it in the sun, how long does it take before the water is drinkable?
It depends where you are, but in Kenya, for example, 2 hours.
2 hours?
Yeah. In Stockholm, in the summer, about 3-4.
And in the winter?
Winter, we have to wait for the sun to come.
You make ice in the winter, don't you? Questions? Here comes one. Here comes another.
So, great idea. My question is whether you reached out to organizations that do emergency relief. Is there an application there? Does this scale up? The size is maybe for a family. Do you have you thought about scalable solutions for larger containers?
Yeah, your first question, as in Haiti, we were, after the earthquake, we were there, and now we are shipping Solvatten to Haiti on this Friday, tomorrow, because we know that Solvatten is also a preventable tool against cholera. So we are working then with the American organization called Hope for Haiti, who have been working quite a long time in Haiti. So it's good to have good partners, but to reach out and in emergency situations, it's important to not just look into drinking water, the whole situation for the family of improve hygiene.
Because Ethiopia had a water crisis this summer, like 1 million people were without water, and that could have been a solution, perhaps.
Absolutely, but when we work, for example, with UN, we are supplier to UN, but when UN look for the cheapest solution, not looking for life cycle analysis, looking at the cost, then we have a hard time to convince them, because you look at for 3 months or not for 7 or 10 years.
I understand. Thank you.
Nita?
Yeah, that actually prompts a lot of other thoughts, but I'll start with, how do people currently get Solvatten? It's a very elegant concept, I like it. How do people currently get it? And also, I don't think I caught what you would do with the grant, what it would go for.
Yeah. Currently, how we work today, it's to find solutions, financial solutions, as with Swedish companies. We work with them to provide them with CSR project, climate project, sustainability project. But we also organize the whole way to the families together with local organizations, and to meet, to reach out, and then communicate back. So it's a very concrete solution, but that's most of Solvatten has been distributed in that way. But then it also some governments and some UN and some NGOs have been buying Solvatten, but it takes some time. It's a quite slow process sometimes. And with use of fund, As I said, we are 5 people, and the world is in need of solutions, and I think Solvatten really has proven to be a good solution. It's not a theory any longer, and I think we need to have more resources on board and to really reach out to scale up. And there are more innovations that could be added to the situation, not just to Solvatten, to the situation where people live in poverty.
That's great. Jeff?
So first question, I understand you have sounds like a particulate filter for the dirty water that you're pouring in. How long do you expect the filter to last, and how do the users of Solvatten replace and get and replace the filters? That's question 1.
Yeah, it's It's a fine mesh filter, this black opening where the water should be poured in. And this filter, it's 35 micron, so it reduces the turbidity. But it's not, didn't want to make it dependent on this filter. It's like in India, you use the saris, a couple of layers, and it's designed to make a local fabric, couple of layers, and you can reduce the turbidity. But if the water is too turbid, you can have a help with the ring, as I said, with the shadow underneath for the good angle to the sun. But that if you can't see the shadow, the water is too turbid. So it's to learn, but people know, and people used to let the water set before, and it's not really a problem. But this filter have been long lasting. We have seen people using it for a couple of years, and it's not an expensive one.
Okay, thank you. The second part of the question goes to building on not just how you would use the funding if you won the award, but really looking at, you've said you've had over 40,000 units, families using this. So your revenue now, are you revenue positive? Are you profitable? So that's part of it. And then how does the award fit into that picture?
Yeah, we are still paying off from the investment in the tooling. So, but if you take away that, we are just on average plus minus zero. And we have I think it was about $1 million if I translate last year's, what do you say?
Okay. One question over here.
Hi, Petra. Apologies if this is a little abrupt. It's very nerve-wracking being up here asking these questions. There's been a lot of discussion at the tables that I've been at about how uptake happens in these communities. Can you talk a little bit about sort of the social aspect of how these products are being adapted into these communities? How does it work, selling them versus giving them away? Can you speak a little bit about your experience in that?
Yeah, first I think the uptake is very direct, where you struggle daily life with a lot of time going to treat water, to improve your life, the healthy life. I think that's very direct. So time given to women helps to really just use it. And people think in Kibera we heard people, I look smart, this is design, this is something for me. Good quality for poor people, I think that's the most important part, that you develop something that really should last long, especially for poor people. Yeah, and we have sold about half the amount of Solvatten used today are sold, but to subsidized price, and half of it is given away. And I think that's important to see. There are people, most vulnerable people can never ever afford, so they can be given with if for example mothers to newborn babies in poor areas in Uganda, they were giving Solvatten, but in return they have to be with the training and also to learn and to, I think, perhaps also to improve the household, to take away up for washing up. You build some shelf coming up from the dirt, and I think to find solutions like that. And we are also working with some voucher system that people in a special project really in need. You see some child-headed families who cannot afford to buy, but if they have a voucher and are involved in the project, they can also get the Solvatten. So, but it's good to have a registry, you know who are using Solvatten. And as we were in Kenya for this summer, for some months ago, and going to the village where they used Solvatten from 2010, and not telling we are coming, and see that it's still in use. I think that's the best award I can have as an inventor, but I think it must be part of daily life.
Right here.
Petra, again, my question is going to be related to design. I understand you did this, it's easy to carry, you know, and maybe young woman or, you know, anyone. How about designing maybe suitcase instead of briefcase type, but maybe on the wheels? And I understand it may take time, but if it is, you know, like a parallel, you know, it may still take the same time, but you may heat it once more water. Did you consider that kind of an approach?
Yeah, first I thought Solvatten should be for fetching water, treating water and storing water. But that was not the situation, because people want to go with a normal jerry can to fetch water. This is special, so they treat it very carefully, take it indoors overnight and so, but also it's used a couple of times a day. And if you use it 4 times a day, you need to have good storage, you have thermos, you have to use it directly, but it's not for storage. So I had to change my mind a bit, but there are ways to make it more. We have local made bags people use to make them themselves, and to have some insulation and to keep it as a thermos. But yes, there are things to do. And as someone asked about bigger solutions, we have tried out, but do you know, you put a big 30 liters Solvatten, but you lose the energy from the sun if you don't have any special equipment to follow the sun. But Solvatten, you can easily change position follow the sun during the day.
Great. Jane.
One of these is going to be a repeat of a question you heard a minute ago, because we need a little bit of a clearer answer about this question, but I want to start with a different point. In hospitals all over the world, there is a new development with regard to the Staphylococcus bacteria, new forms of it that are antibiotic resistant taking over. And it's been discovered that in hospitals, if hygiene can be improved, then lives can be saved that are now at risk. Not from the surgical procedures, not from the illnesses, but from what the hospital environment produces in the way of unconquerable bacteria. So my question to you is, have you tried bringing this product into hospital environments in order to improve public health generally? That's one question. I might ask you to just answer that question before I go to the other one. Go ahead.
Yeah, we're working with maternity clinics but in countries like Kenya, Mali, Uganda, and the situation is really, the water is contaminated from the beginning. You're right. Giving birth in a dirty surrounding, and if the midwife could have washed her hand and we'd have some good water to wash her hands with, it would probably prevent some of the infections that could occur. Yes, but of course it could be looked into much deeper, and we would love to come into closer to it, especially the hygiene question and prevention.
Okay, so going back now to a question you were asked a minute ago, because this has come up in a number of table discussions. The question is about a behavioral economics theory called the Endowment Effect, and it goes like this. The theory is, if you give something to someone, they will value it less than if you sell the same product to someone, because putting their own investment into the product at the front end creates a sense of greater value, a sense of greater attachment, if you will, or investment or valuation, than if you simply give them the product. And I wondered, and a number of people are wondering, whether with respect to your product, you notice any distinction at all with regard to value over time if the product is given rather than sold?
I wish I could tell, because it's also something how we work to sell Solvatten. But in situations like emergency situations, and you come to Haiti, to organize a selling structure in a chaos situation, it's not easy and it's going to take time. And how many people on the way are suffering or dying, or, I mean, so you have to make a choice. Shall we do something today, and or shall we sell 10 Solvatten units a month or a week to I mean, it's really different situations. But I think of course you appreciate something that you're not just given. You have to make a choice. I want this. Mm-hmm. But you can wish to have it if you perhaps in kind payment somehow.
Okay, so I'm afraid we're at the end of our time. I'm sorry, but we're gonna. Petra, that was fantastic. Thank you very much.
Thank you.